Getting steer learners. This is going to be our last lecture of this course. Although I discussed a lot of things related to toxicology, from general aspects of toxicology to the laws in relation to toxicology, general management of toxicology, and the analytical aspects of toxicology, and the individual poisons and their management and the mechanism of actions and the clinical features, and a lot many more things I discussed throughout this course. I find that a lot of things I could not cover. Toxicology is one of the vast subject to learn. You cannot learn it through a months of the courses. Every subject of medical science asks you to keep yourself updated and practice more. The more you practice, the more you become better in that field and excel in the field. Nowadays, many toxicologists are identifying themselves as toxicologists and are getting opportunities to work at the corporate hospitals. Some toxicologists are even running independent clinics and their hospitals, and they are helping the society tremendously. And in return, they are getting the reputation and the good earnings as well. So, the knowledge of toxicology is not only helping you to manage the patients, but it is helping you to prevent from the poisoning, to prevent yourself and your family, your surrounding, the society. So the knowledge of toxicology is very important in general. Although toxicology is said to be one of the boring subject in the medical science, particularly during the undergraduate period, I try to make it interesting and useful for you to the best of my capabilities in the present situation, particularly when we are talking over the video mode. In that, the interaction becomes poor and we cannot convey a very qualitative class over the video lectures. But still, I tried my best to convey my knowledge and the understanding about the toxicology. The purpose of these lectures or the toxicology course is not to teach you everything, but to develop an understanding and interest in the toxicology so that you keep yourself updating, you keep reading, so that and interacting with the patients and the managing them, so that you improve with the time and you become the better clinician and the toxicologist. In the future courses, definitely I will try to make them more crisp and informative for all of you. So I expect you to give the correct feedback for the course, including the both positive and the negative aspect of the whole of this course. Also, I request you to give the correct suggestion so that it may be improved in future positively. Hope all of you have enjoyed my lectures and doing well. As we had very limited time period and the paucity of the courses, I could not cover many of the important topics. Some of the remaining important topics I will be covering quickly for you. You have to go about the detail of them by yourself. So without wasting much time, I will be coming to some of the important topics that we should know. One is the substance abuse. We already learned the definition of the substance abuse. Substance abuse refers to the harmful or hazardous use of the psychoactive substances, including alcohol and the illicit drugs. During the alcohol, we already talked that this definition of the substance abuse. So, alcohol is included in the substance abuse chapter. And apart from that, other psychoactive substances and the illicit drugs, they are all the part of this substance abuse. Then the DSM-5, that is the current diagnostic and statistic manual of the mental health disorders. That current version that is running is a 5, that also recognizes the substance related disorders. So the wording in the case of the substance abuse, use and disorders is very important. Slight wording differences makes the change of the meaning and its application. So as per DSM-5, it recognizes substance related disorders resulting from the use of 10 separate classes of drugs that includes the alcohol, caffeine, cannabis, hallucinogens, inhalants, opioids, sedatives, hypnotics, anxiolytics, stimulants like amphetamines and cocaines and other stimulants, tobacco and other known or other categories of the substances that are psychoactive substances. So these all includes under the substance abuse. Then substance related disorders can be divided into the two types: substance use disorder and the substance induced disorder. Substance use disorder is characterized by impaired control over the substance use. So the person is not able to control the need of that substance. That is, the psychologically he is dependent on that drug. Further, as per the DSM-5, they are classified into the mild, moderate and the severe categories based on the certain diagnostic criteria and the dependence classification and all those details. Then the substance-induced disorder, that includes the intoxication, withdrawal effect or the substance-induced mental disorders. That includes the acute effect, acute intake of the drug that can be intoxic to the person, their withdrawal effect and the substance-induced mental disorders. These are all included under the substance-induced disorders. So, substance-related disorders are classified into substance-use disorders and substance-induced disorders. Then another category is the addictive disorders, that encompasses the other form of the addictions like the gambling, excessive behavior, internet gaming and shopping addiction. Although this has not been characteristically characterized under any disease or the mental illness, but they are certain forms of the addictive disorders. And as per the international classification of disease, the present international classification of disease that running is the 11th. So under that, it has been categorized as the disorders due to the substance use or the addictive behaviors. So the ICD-11 uses the term substance use or the addictive behaviors word. Mental and the behavioral disorders resulting from the psychoactive substances or the specific repetitive behaviors are all included under this classification. Before the use of substance abuse, drug dependence, drug addiction, drug habituation words were used. Now the drug dependence word is replacing the word drug addiction and the habituation. So for the drug addiction and the habituation, a common word, that is the drug dependence. So in the meaning of the drug addiction and the drug habituation, we need to know the difference between the drug addiction and the habituation. In the drug addiction, the person is the physically and the psychologically dependent on that drug, that is the drug addiction. Whereas in the drug habituation, the person is only psychologically dependent on the drug. So if there is a withdrawal of the drug, in that case the relapse or the withdrawal symptoms or physical symptoms will be produced in case of the drug addiction. Whereas in case of habituation, it is just the desire, so the physical sign and symptoms of the withdrawal will not be produced, and there is no compulsion to intake of the drugs in cases of the drug habituation. The examples of the drug addiction include the alcohol dependence, opioid dependence, cannabis dependence, cocaine dependence, amphetamine, barbiturates and others. And the drug habituation include the caffeine, nicotine and the tea dependence that is regularly taken in the almost every households. And the most commonly abused drug in India include the caffeine, nicotine and alcohol that are the legally allowed, whereas the illegal substances that are not allowed and they are abused are the cannabis and the cocaine. That is in the increasing order. Caffeine is the commonest, then the nicotine, then the alcohol, and in the illicit categories, that is cannabis and then cocaine. Then drug of abuse can be categorized into the narcotic drugs and the non-narcotic drug. Narcotic drugs, that means induces the narcosis, that is sleep inducing drugs. They are the hard drugs. They include the opium, coca, cannabis and all other manufactured drugs. Non-narcotic drugs, that is soft drug, they are the hypnotics, antidepressants, hallucinogens, sedatives. These are the categorized under the non-narcotic drugs. The routes of the administration of these drugs can be the oral, inhalation or the chasing the dragon like of thing, that they smoke it and then inhale the smoking. Then snorting, sniffing through the nose, particularly the cocaine. In those cases, you may find the cocaine abusers, nasal septum, perforation of the nasal septum can be seen. That can be seen on the post-mortem examination as well in those patients. Then there can be the injection, skin popping, that can be injection can be through the subcutaneous. In that case, the skin popping marks can be seen on the skin of those person. Then they can be given through the IV line, that is called main lining. They are directly injected through the intravenous routes. Then the intramuscularly they can be given. So these injection marks can be seen on the bodies of those drug abusers, and they are one of the characteristic findings seen even at the autopsies and the examination of the living to indicate the drug abusers. In case of death of person due to the drug of abuse, The post-mortem examination may show the emaciation, scars at the site of the injection mark, multiple tattoos, because tattoos are usually used by those persons to hide the injection sites, and underneath they are exposing themselves. And apart from that, on the internal examination, various abscesses in lung infections and associated injection related illnesses may be present, like HIV and hepatitis, because they keep sharing their injection with the different drug abusers. They are involved in the crimes, they are involved in the sexual abuses, so they have the different sorts of the other complications and illness. Particularly, they usually have the respiratory infections, and you may find the lung abscesses and all those things, gastrointestinal abscesses. We can also see for the nasal septal perforation, particularly in case of the cocaine inhalants. So these all findings can be seen in the persons who have died because of the drug abuse. Usually, these drug abusers die on the chronic illness because of the associated illness. Hardly they will be getting intoxicated because of the overdose of any particular drug. In that case, the overdose symptoms of the any drug can be seen, and in that case, the toxicological analysis and the level of the drug in the blood can be useful for the analysis. Many cardiac changes, cardiomyopathies, and other endocarditis might be seen in case of the IV abusers. So the heart shall be examined very properly in those cases. Then another important facts related to the drug abusers are the body packers and the body stuffer syndromes. Body packers are those person who are carrying the drugs in form of the organized plastic forms, and they carry it for the transporting from one place to another place. So they are basically using this packaging for the smuggling purposes. So they are called as the body packers. So they swallow the drug for the smuggling purposes, whereas the body stuffers conceal the drug when facing the arrest. They are using it for their own purposes, or they have the minor quantity of any drug. They are carrying it, and when they find that they can be arrested or the caught by someone, they immediately ingest it or inhale it or put in the body cavities. So those cases are called as the body stuffers. So usually the accidental poisonings or the poisonous effect of these drugs are seen in cases of the body stuffers, whereas the accidental poisoning can happen in the body packers when the package may lose or the burst in the body. So there is the severe poisoning, and the person may die due to the poisoning by the effect of those drugs. You can see here the pictures of the postmortem cases where the person was carrying the heroin and abuses in the form of these capsules. So the capsules are in well packaged form. You will find, apart from this reason for the death, one capsule would have bursted out, and apart from that, you will find a multiple more capsules in those cases. Here the X-ray will show a pattern of the capsules in the body, and later they uses the cathartics to take them out. So in the body packers, X-ray is very useful to diagnose the body packer syndrome. You may find this organized form of the different shadows of the condom packets containing the drugs inside the body cavity. Then the common drugs of abuse are the amphetamines, tricyclic antidepressant, phencyclophenexine, phenadine, hallucinogens, and the designer's drug. The designer's drug are basically those drugs. Usually these drugs have the fixed chemical composition, and they are banned by the different countries. But the person who are running the racket of the transportation of these drugs, or the drug dealers that are involved, they try to escape this fixed drug composition that had been banned by creating a designer drug that they create it through the slight chemical alteration in the legal drug. This is basically the illegal substances are produced in form of the legalization of the illegal substances are basically done. The illegal substances that is banned by the authorities, so they create the certain alteration in the chemical composition, and it becomes the legal because they are not banned by any government or authorities. So when the chemical detection will come out, they can prove before the court of law that this is not the banned compound, so they are allowed to carry it, and so they escape the law and the legal punishments. So this is the basic use or the basic concept behind the designer's drug. So they can escape the punishment even though they will be caught using those drugs or transporting those drugs or abusing with those drugs involved. So this is the designer drug that is being used. Then you must know the certain drugs that are used for the drug facilitated sexual assault or the drug rape crimes. These drugs are used because they incapacitates the individual and facilitates in the sexual assaults. The commonly used substance for the this purpose are the alcohol, gamma hydroxybutyric acid, flunitrazepam, rohypnol, that was the once very common in the news. Then the ecstasy, that is also MDMA. You must know details of these drugs in detail. I will not be going in the detail right now, but I will suggest you to go in the detail of these drugs and the substance abuse disorders and all the aspects related to it. The government is also working and very highly focused on the management of these substance abuse disorders. They are running the substance abuse treatment clinics. They have the Nasa Mukti Abhiyan, and there is huge funding for all those purposes. So you must know all of those things. I will not be going in much detail for that now. Coming to our next topic, that is the environmental toxicology. Although this is the very vast and itself a broad aspect of the toxicology, we already discussed many components of the environmental toxicology, particularly the toxicity due to the heavy metals that can contaminate air, water, and the soil. I will be only talking about the particulate matter pollution because it is the one of the recent air pollution known to affect the health of the humans. We will be learning some facts related to the particulate matter. It is a global health concern, ranking 12th among the risk factor for the disability adjusted life years. Particulate matter is a small, solid or the liquid particles suspended in the air and the classified by the size into the PM10, that is less than 10 micrometer, or the PM 2.5, that is the less than 2.5 micrometer. It has been seen that it affects the climate, ecosystem and the human health, with the traffic related particulate matters being the major concern. Particulate matters originate from the natural sources like dust and the volcanoes, but human activities also significantly increase at its level, particularly the heavy traffics on the road. Urban area with the high traffic density suffer the most from this particulate matter, with the PM 2.5 level up to 140% higher than the suburban areas. PM 2.5 is seen to be primary contributor to the global health risk from the outdoor air pollution. It can penetrate the lung alveoli and enter the bloodstream, causing inflammation and the oxidative damages, leading to the cardiovascular and the nervous system tissue damages. Exposure to the particulate matters can cause inflammatory responses, cardiovascular changes, and the cancer and other health problems. The extent of these health effects depend on the factors like age, lifestyle, health status, and the exposure level. So these particulate matters are important concern for those who are concerned with the health system. So this is basic mechanism of action of the particulate matter. It affects the lung, the cardiovascular system, then it affects on the nervous system and the major mast cells and all those things. So in this way, it acts on the body, different parts of the body, and on long term, if it has a very toxic effect, and it is responsible for reduction in the lifespan of the humans. So these are all parts of the environmental toxicology. I will suggest you to read about the more of the such exposure on the human health. Then another important concept you need to know in the environmental toxicology is about the Workmen's Compensation Act 1923. This Workmen Compensation Act 1923 was further amended in 2009 and 2017. The Workmen Compensation Act 1923, now known as Employees Compensation Act, ensures the financial compensation for the employees injured or killed on the duty. All the employees, including temporary and the part-time workers, are covered, especially those in the industries like railways, aviation, construction, mines, and the factories. Employers with more than 10 workers in the covered sector must comply with the Act. Coverage includes the compensation for the injuries and the temporary and the permanent disabilities and the death arising from the workplace accidents or the different conditions. Compensation amount depend on the nature of the injury. Temporary disabilities are given with the support of the up to 25% of the monthly wages. Permanent or total disabilities are covered with the 60% of the monthly wages or 1,20,000, whichever is the higher. Then permanent partial disabilities, they need to be covered with a percentage of lost earning as per the Schedule 1 of the Act. And in case of death of the person, 50% of the deceased monthly wages or rupees 1,20,000, whichever is higher. In this way, the coverings in case of the Workmen Compensation Act 1923 is recommended. So, the purpose of knowing about the Workmen Compensation Act related to the environment is that the certain occupational diseases that are occurring because of the environmental condition at the workplace, they are also covered under the Workmen's Compensation Act. They are included in the Schedule 3 of the Section 3 of this Workmen Compensation Act. You can see here the occupational diseases that are included. They are the Part A and Part B and Part C. They have been categorized into 3 categories. In the Part A, they include the infectious or the parasitic diseases contracted in an occupation where there is a particular risk of the contamination, diseases caused by the work in the compromised air, then diseases caused by the lead or its toxic compounds. So, you need to know these all compounds and their toxic effects so that you may diagnose it, as the patient may be brought by the industries for the examination. The effect on the body is due to this toxic exposure or not, like poisoning by the nitrous fumes, poisoning by the organophosphorus compounds, disease caused by the phosphorus or its toxic compound, then the disease caused by the mercury or its toxic compounds, disease caused by the benzene, the disease caused by the nitro or amino toxic derivatives, chromium or its toxic compound, then arsenic or toxic compound, then the radioactive substances, then the primary epithelioma or the cancer of the skin caused by the tar, pitch, bitumen, mineral oil, anthracene or the compounds, product or residue of these substances, disease caused by the toxic halogen derivatives of the hydrocarbons, disease caused by the carbon disulfide, occupational cataract due to the infrared radiations, disease caused by the manganese or its toxic compound, skin disease caused by the physical or the chemical or the biological agents not included in other items, hearing impairment caused by the noise, poisoning by the dinitrophenol or the homologous compounds, then disease caused by the beryllium, cadmium, and the occupational asthma caused by the recognized sensitizing agents, disease caused by the fluorine, disease caused by the nitroglycerin, disease caused by the alcohol or the ketones, disease caused by the asphyxiants like carbon monoxide and its toxic derivative hydrogen sulfide, lung cancer, mesothelioma, asbestos, primary neoplasm of the epithelial lining or the urinary bladder or the kidney or the ureter, snow blindness in the snowbound areas, disease due to effect of the heat in extreme hot climate condition. Then the Part C includes the pneumoconiosis caused by the sclerosing mineral dust, silicosis, anthracose silicosis, asbestosis. So these are all the part of the environmental toxicology that you need to know. Bagosis, that is the exposure of the sugarcane dust. Bronchopulmonary disease caused by the cotton, flax, hemp or the sisal dust, that is the biocinosis. Then extrinsic allergic alveolitis caused by inhalation of the organic dust, bronchopulmonary diseases caused by the hard metals, acute pulmonary edema of the high altitude. These are all included under Part A, B and C of the Act, and accordingly the compensation shall be given. And so you need to know and the features and how to examine those persons. That is of the importance for us, particularly from the medical legal point of view. And the last topic that I will be covering is the Poison Information Center. You need to know about the Poison Information Center. They are very helpful ad for the knowing about the poisons. You may contact the Poison Information Centers for your own reasons, and you may consult for the poisoning cases, and you may take the advice of those centers. So, what is the Poison Information Center? You need to know. The Poison Information Services first time originated in the Netherlands in the 1949, addressing rising poisonous cases globally. Since then, the similar centers have been established worldwide, including in the UK and the USA. In India, the National Poison Information Center began in 1994 at All India Institute of Medical Science, New Delhi. Since then, there are the innumerable centers, regional centers have been established throughout India. These centers basically provide the vital toxicological assistance, and they utilize the international toxicological databases like PoisonDex, that is from the US database, then ToxBase, that is UK database, and Toxins, that is New Zealand database. So they use these assistants. You can also log in to these databases and know the relevant information about the different poisonous substances. Also, they have the analytical toxicological laboratory that is attached to the center to test for the common poisons or the drugs in the body fluid, as well as in the water and the medicinal preparation or other commercial products. So there is the one is the poison information and the associated analytical labs in them. They offer the immediate help over the phone for various poisoning situations, including household product ingestion and the drug overdose. The regional poison centers, typically located in the university, medical colleges, or hospital, serves the millions of the people and handle thousands of exposure cases annually. These poison centers are staffed by the medical professionals, specialists, and they provide consultation across the medical specialties, managing most cases through the cost-effective telephone consultations. You need to know that National Poison Information Center, that is in the AIMS, New Delhi, the toll-free number for this information center is 1800 116 117, and this is telephone number and this is the mail ID for them. So you may contact them in case of the any issues that you are not able to handle, or even the local household people, they can consult this toll-free number and they can ask the queries related to intoxication of their relatives or themselves. Many times the children who are not aware and they ingest some unknown liquids that is kept in the household, and in that case the parents are unaware what is the composition and what shall we do now. So in those cases you may call on this toll free number and ask. They will guide you, they will suggest you need to observe and what you need to do immediately for the proper care, what are facilities they will ask, and accordingly they will advise you, and they give you the best of advices, and they are the authentic centers. So you must seek the advice from these poison information center. Then another important concept is the poison severity scores. This is particularly useful for those working in the poison information center or for the toxicological emergency cases. So this help you to assess the severity of the poisonous cases. This was developed collaboratively by the International Program on the Chemical Safety and the Swedish Poison Information Service, with the support from the European Association of the Poison Centers and the clinical toxicologists and the European Commission. The poison severity score provides a standardized scale for the grading the severity of the acute poisoning. It categorizes signs and the symptoms by the body system and to classify the toxicity levels as the minor, moderate, or the severe categories. So if in the according to the different system wise, if there is no symptoms or the signs related to poisoning, then the severity scale is 0. 1, when there is a mild, transient, or spontaneously resolving symptom, then it is the minor category. When it is the pronounced or the prolonged symptoms, then it is the moderate category. Severe or life-threatening symptoms, then it is severe category. And in case of death, it is fatal, that is 4, fatal category. So it is a standardized scale that allows for the qualitative assessment for the poisoning severity, aiding in the risk identification and the data comparability. It is applicable to both adults and the children for acute poisoning, emphasizing the evaluation of observed clinical symptoms and sign rather than estimating risk based on the factors like ingestion, amount, and the serum concentration. Treatment measures indirectly inform the severity evaluation, and the death are graded separately on the precise data representation. In this way, the poison severity scores work. You can find this poison severity score on the WHO website, and there they have categorized how to calculate this poison severity score systematic wise. Like on GI tract, if there is no symptoms, then there is none. Then minor, if there is vomiting, diarrhea, and pain. Inhalation, first degree burns, and the minimal ulceration in the mouth. Endoscopy, erythema, and edema, that is in the minor category. Moderate category, pronounced or the prolonged vomiting, diarrhea, pain, and ileus, first degree burn, dysphagia, endoscopy, and ulcerative lesions, then in this case moderate category. Then severe category is the massive hemorrhage, perforation, more widespread second and third degree burns, severe dysphagia, endoscopy, ulcerative intramural lesions, circumferential lesions, and the perforation. This is severe category. In this way, on call also, they will ask you all the details. If they have these findings, they can categorize it into the minor, moderate, or severe category, and accordingly they will advise you. So in this way, this various system for the respiratory, nervous system, then for cardiovascular system, metabolic balances changes, liver, kidney, different system, there is a separate categorization of the symptoms, and they have the mild, moderate, severe categorization. Blood, muscular system, local effects on the skin, local effect on the eyes, local effect on the bites or the sting. So these findings will suggest whether the category is mild, moderate, or severe category, or it is fatal. So you must go through this poisoning severity score, and you must have the knowledge about the how to calculate the severity score. So dear learners, this ends our course. Spending 3 months of time with you was a great experience for me. I will say that learning about toxicology is an unending journey. You would have understood by now that I have covered a very small part of the entire toxicology. You need to keep learning and practicing to keep updated in the toxicology. You may refer to the books and the references given with the respective topics for your better understanding of the subject. I will love to listen from you about your experience from the course and any queries related to the toxicology. You may communicate with me on my Gmail in future, that is dr.jitendrak2@gmail.com. Best wishes for you in your career. Stay happy, healthy, and serve the humanity to your best. Thank you so much. Stay blessed. Thank you.